Welcome, and thank you all for joining us this morning. I'm Mary Leslie. I'm president of the Los Angeles Business Council, and today is our fourth webinar in partnerships with Wells Fargo, exploring COVID-19's impact on California's housing crisis. Over 350 of you are joining us this morning, and you will be hearing from experts and decision makers. Hopefully you were able to join us for one of the last three webinars we had, focusing on housing, which included Governor Newsom's top housing and homeless advisors, state legislators, homeless experts, and decision makers. They informed us about the current efforts to provide emergency housing for our at-risk and homeless populations, and the virus's impact on efforts already underway that have placed urgency on many of our local and state initiatives. Today, we are honored to be joined by our county, city, nonprofit, and business leaders. Kicking off today's presentation will be LA County Supervisor Hilda Solis, followed by Chief Housing Officer for Mayor Eric Garcetti, Amy Anderson, a longtime advocate and policymaker, Vice President of Health and Housing at the California Community Foundation, and Sewill, and a well-known and respected business leader, Chairman and CEO of Related California, Bill Witte. Today's speakers will address LA County and LA City's efforts to provide homeless housing, the status of emergency shelters, and post-COVID housing strategies. What are they? In addition, we'll have a discussion about priorities for new federal assistance, as well as discuss how the COVID-19 crisis has impacted housing construction and financing costs, and the necessary reforms and expansions needed for affordable housing tax credits. The LABC has been working diligently during this time with our local, state, and federal leaders to advocate for policies and programs that will provide not only emergency resources for our homeless population, but also look to long-term solutions post-COVID. At the end of the presentation today, we will have time for questions and answers. If you would like to submit a question, please feel free to do so during the presentation using your Q&A feature at the bottom of your screen. Following Q&A, Adam Lane, LABC's VP of Programs, will give a short update of our latest legislation that we are tracking, including the county's push to house the senior homeless population and the recent introduction of a bill by Congresswoman Maxine Waters to provide $100 billion in emergency rental assistance. Today's webinar is graciously brought to you by Wells Fargo, who has dedicated hundreds of millions of dollars to address food, shelter, and small business and housing stability. Wells Fargo has also suspended residential property foreclosure sales, evictions, and voluntary auto repossessions to help do their part in protecting vulnerable residents. We want to thank them for their support and introduce our good friend, Wells Fargo Senior VP of Corporate Philanthropy and Community Relations, Greg Shirkett. Greg, welcome.
Thank you, Mary. Good morning, everybody. We appreciate this partnership with the LABC. This is the fourth webinar in our series on housing and homelessness. And as you mentioned, Wells Fargo is donating $175 million nationally to support economic recovery for counties and vulnerable communities across the county affected and the country affected by COVID-19. Locally, we'll be providing more than $9 million in grants and charitable donations to provide support, focusing on three primary areas: small business recovery, financial health of individuals and families, and housing affordability, with a particular emphasis on foreclosure prevention, rental assistance, and support to housing and homeless service providers who are getting our unhoused neighbors off the street and into shelters and keeping them housed long-term. The only way we can do this is through public and private partnerships and collaborating with other leaders in the state and county, which is why I'm so pleased to introduce LA's bold leader, Supervisor Solis. Supervisor Hilda Solis was sworn in as Los Angeles County Supervisor for the 1st District of Los Angeles County on December 1st, 2014. She was reelected to a new 4-year term in 2018. During the COVID-19 crisis, Supervisor Solis continues to prioritize combating homelessness, building affordable housing, and creating a strong workforce with the local economy, and most critically during this pandemic, expanding healthcare access to our most vulnerable communities. Prior to becoming supervisor, Ms. Solis served as Secretary of Labor under President Barack Obama. Supervisor Solis was confirmed on February 24th, 2009, becoming the first Latina to serve in the U.S. cabinet and was at the forefront of helping the U.S. economy recover from the Great Recession. We appreciate her expertise and dedication to public service, and now it's my honor to turn it over to Supervisor Solis.
Thank you so much, Greg. What a very nice introduction. I want to give a shout out to all the panelists and especially to Mary Leslie for inviting me to be a part of this very special and important conference sponsored by the Los Angeles Business Council and many of you. And COVID-19 is on the minds of everyone. It just encapsulates everything that we're doing, especially here, more importantly at the county. I do want to mention that I'm also being joined by Joe Nikita, who's Director of the Department of Consumer and Business Affairs. He'll be online if there's any further questions that people might have, as well as Emilio Salas, our Acting Director of Los Angeles County Department Authority. These two departments have been instrumental critically in our response to COVID-19 and will also play an important role in our future recovery efforts. The pandemic, as you know, has impacted every segment of our population and our economy, and the county's response to those impacts require an approach that utilizes every resource at our disposal. So slide 1, if we could show that, Project ROOMKEY is a perfect example of using the existing resources available within the county. Many of you have already become familiar with Governor Gavin Newsom's Project ROOMKEY initiative. Project ROOMKEY is a statewide effort to partner with counties and cities to lease hotels and motels to provide immediate shelter to vulnerable individuals experiencing homelessness, especially those people who are over 65 years of age or who have underlying medical conditions. And many of you know well that we have over 59,000 people experiencing homelessness. 75% of those are unsheltered, and 25% are housed in our interim housing sites. And we know that congregate settings are not ideal, especially during this crisis. Homelessness and health experts have shared the unsheltered homeless population. They're at risk of contracting the virus because they are older and have serious underlying health conditions. People experiencing homelessness, as you know, have a higher burden of cardiopulmonary and COPD, chronic obstructive pulmonary disease, heart failure, and diabetes. And they also experience accelerated aging and frailty. Additionally, as you may know, people experiencing homelessness have limited access to hygiene supplies and live in conditions that limit infection control practices and often live in communal settings such as shelters or crowded encampments. With Project ROOMKEY, we're able to leverage federal funding, FEMA funding, to help individuals come indoor to safely isolate, protect themselves from COVID-19, and also help to continue flattening the curve so that we are all in a better place. In my district, we have worked closely with cities such as Monterey Park, El Monte, Rosemead, Pomona, and many others to stand up Project ROOMKEY sites. And it's important to me that our cities, especially the city of LA, undertake this very seriously, because this is a health care crisis, and we need to rely on the support from all of our neighbors in order to follow suit on the safer at home orders. Countywide, we have leased at this point 3,100 rooms already, and we're also beginning to strategize about what comes next, and that is hopefully creating a path to permanent housing for these individuals. We're committed to working with the state and the governor to make Project ROOMKEY a success, but we also find that we have to look at long-term solutions so those individuals that are being housed, not just in hotels and motels, but have permanent housing solutions. Next slide, please. We've also taken other major steps to prevent future instances of homelessness occurring as a result of the pandemic. And according to a 2018 study by the Economic Roundtable, it's estimated that about 600,000 Angelenos spend more than 90% of their income on housing. These severely rent-burdened households should not have to decide between paying the rent or putting food on their table. That's why the county passed an eviction moratorium effective March the 4th to protect renters from being pushed out of their homes during the public health crisis. The moratorium, as you know, is far-reaching, covering residential units, commercial spaces, mobile homes, and space renters. Our eviction moratorium, as you know, is also effective in the incorporated cities that do not have their own eviction moratorium in place. And last month, some of you may know, I authored a motion to further strengthen our eviction moratorium to provide even more protections for renters, including the following: providing 1 year, full year for tenants to repay any rent not paid during the pandemic, prohibition of evictions based on unauthorized occupants such as pets or nuisances related to COVID-19, prohibition of charging of late fees, interest, or any other penalties for unpaid rent during the emergency, and acceptance of self-certification from tenants to demonstrate an inability to pay rent. The moratorium also enacts a rent increase freeze for any unit covered by the county rent stabilization ordinance. And this coming Tuesday at our next Board of Supervisors meeting, we'll be looking to strengthen the eviction moratorium even further by extending the effective date to the end of August 31st, 2020. This will help keep renters housed while they seek to re-enter the workforce and increase their hours. But next slide. However, we're also looking at how we can make our eviction moratorium more effective and keeping renters and businesses in their homes and spaces. And this is only one piece of the puzzle. So I want to explain that the impacts of COVID-19, as you know, are varied, and so are our strategies to help so many residents. The county has taken on a number of efforts to provide economic relief to both renters and businesses. And as of April 14th, I authored a motion with Supervisor Hahn to develop a rental assistance program to help our most rent burden and impacted residents weather the storm. Details of the program are still in development, but we want to target not only households and large businesses, but also mom and pop landlords as well. Our county departments have been hard hit, and we know that we need to seek more economic relief. Through our Department of Workforce Development, Aging and Community Services, known as WEDACS, we awarded over $500,000 to 59 local businesses, 12 of which were in my district, provided by the state of California. Each business was awarded up to $10,000 in grant funding through an employer assistant grant fund to help fund payroll and operating expenses. And additionally, last month, we also launched a business assistance program in partnership with Goldman Sachs, who helped to provide $15 million in supplemental private capital to small businesses and nonprofits in the county. This was funded through the CARES Act, the first sequence. The county will continue, as you know, to develop additional relief programs to address the increasing pressures placed on our economy. We anticipate releasing more economic relief packages later in the month, and we'll have more details in a few weeks. For further information, I would encourage you to go to COVID-19 Help Center at lacountyhelpcenter.org. Next slide, please. We're beginning to envision the future of our economy post-COVID-19. And one of the most important undertakings that the board has taken is the formation of what we are calling the Economic Resiliency Task Force. Through this task force, we will develop an actionable set of recommendations that will revitalize our economy and bring us back to full employment levels. A recent estimate of the Los Angeles Economic Development Corporation shows that by the end of the month, Southern California could have 2.8 million fewer jobs than the same time last year. That's a 27% decrease. And I know the impacts of the recession all too well, having served as former Secretary of Labor during the Great Recession back in 2008. That's why I know we need a plan to carefully and safely reopen the economy. Supervisor Barger and I are working with our departments on our Economic Resiliency Task Force to develop that plan. And tomorrow we'll be releasing it. We've identified 13 sectors to focus on our efforts. They include the following: infrastructure, small business, healthcare, film and digital media, sports entertainment, education, among others. The plan will include both short-term and medium-term and long-term recovery strategies that include industry partnerships, policy changes to spur growth at the local, state, and federal level. And we'll employ a number of strategies, including development of financial incentives and job training programs, including leveraging public-private partnerships. The first convening, as I said, will be tomorrow afternoon, and it will be led by all 5 of the County Board of Supervisors. We'll need this partnership with you all here that are listening and watching, and I hope that you'll become potential partners to help us with this recovery that so many people right now are looking for our leadership and your help. So thank you for having me, and I'll go back to you now.
Terrific. Thank you so much, Supervisor, and for everything that you're doing. And we look forward to working with you on the next stage here of the economic as well as the housing relief that we're going to need. Now I'm pleased to welcome Amy Anderson, Chief Housing Officer for Mayor Garcetti. Prior to joining the mayor's office in November 2019, Amy led the work of PATH, a nonprofit provider, and she provided strategic and technical consulting around affordable housing finance for California Housing Partnership Corporation. In 2017, Speaker Rendon appointed her to serve on the newly created Homeless Coordinating and Financing Council, whose role was to expand in 2018 to whose role was expanded in 2018 to oversee Homeless Emergency Assistance Program, HEAP, to fund actual awards. So please welcome Amy Anderson.
Hi, Mary. Thanks so much. Happy to be a part of this webinar this morning. Really appreciate you including the mayor's office. We are excited to share how the city is responding during this crisis to protect people who are experiencing homelessness. It's nice to follow Supervisor Solis because I think one of the hallmarks of the response in protecting people who are experiencing homelessness has been the coordination and collaboration between the city and the county, as well as our partner with LASA and our fantastic service providers. So well done on the agenda ordering. I guess if we could go to the first slide. Next slide, please. Yeah, so the city's three primary goals in protecting people experiencing homelessness when the COVID crisis began was to focus on saving lives by bringing as many people as we could indoors, by preventing the spread of the virus through assessments and testing, and as I just said, in working collaboratively to really lift up and prioritize the interests of people experiencing homelessness. Next slide, please. So our first and immediate action was to create temporary shelters at some of the city's recreation centers. It won't be a surprise to you that there are contingency plans in place for when and if there is a disaster. I think typically we would think about an earthquake, that the recreation centers would serve as shelter for people who could no longer be in their homes. So we implemented those contingency plans, started with 13 shelters, but have now increased to 24 sites where we're serving about 1,000 people. These are congregate settings, but we worked really closely with the county's Department of Public Health to make sure that there were protocols in place for disinfecting, shared areas and distributing cots. Everybody's spaced 6 feet apart, and positive cases at the shelters have been very minimal. We also benefited from the trailers that the state, the governor, made available. We have, as of Monday, this coming Monday, we will have 300 trailers also located at our recreation and park locations, mostly in the parking lots, where an additional 300 people are able to safely shelter in place as trailers. This is more of a model that's like Project ROOMKEY, where each person participating has their own room, has their own bathroom. There's not a need for the shared facilities. I won't spend a lot of time on Project ROOMKEY because Supervisor Solis walked us through that. I think a couple of highlights are within the city of Los Angeles, we have about 1,400 rooms under contract at 13 different sites, so close to half of the overall county. And really our significant milestone was that just this week we started, we'll be starting operations at a hotel in downtown with over 450 rooms, which is very important to serve the homeless population in the downtown. I do want to highlight this number down at the bottom of this slide, the 15,000, because this is an aggressive target. It's the target of the number of people that we're trying to serve in Project ROOMKEY and in these emergency shelters that the city has stood up. And that's also the same number of folks that the governor is trying to target with the Project ROOMKEY. But I think what's special and important about the 15,000 is it is based on an analysis by LASA of whom in our unsheltered population is most at risk and needs protection, needs to be prioritized. And as the supervisor walked through, those are folks who are 65 and over or have a complicating health condition. So next slide, please. So limiting the spread of the virus was also a goal and a priority for the city. The way we've approached that is through testing and assessments. Testing is happening through mobile clinics. Mobile clinic stations are being stood up near to kind of dense encampments. Those mobile testing clinics stay for a day, test as many people who are interested in being tested, and then move to another location. In Skid Row, we're doing something similar but a little bit different. We're calling those pop-up testing sites. Those sites, those stations are stood up and they stay for a week. And that's helpful because it allows, given the large unsheltered population in Skid Row, it gives time for people to know that the testing station has been stood up and they can go. And then they'll move to another location the next week. So all told, it's fascinating. I'm just looking at my notes because even, no, that's right. So 1,200, oh yeah, no, sorry. I'm just highlighting that even between yesterday and today, the numbers have changed. So at these two testing sites, testing types, we've tested over 1,200 individuals. We're testing about 100 people a day, as it says in Skid Row. We're also doing testing through clinics and at shelters, and have been able to test 2,000 people combined. And the positive rate, I'm happy to say, is only about 1%. So 204 people in the city of Los Angeles experiencing homelessness have tested positive. So next slide. I like to think of this street surge and testing combination as our kind of South Korea strategy. I don't know how many folks know that the WHO, praised South Korea and its ability to inhibit the spread of the virus, in part because they are assessing people everywhere. You can't go into a grocery store or to a shopping center without being assessed. And we really were trying to replicate some of that with our population that's experiencing unsheltered homelessness. So the medical street surge are teams of outreach workers, a medical professional, police, or fire, who are going to encampments, connecting with people, doing an assessment of symptoms, taking temperatures, and if someone is exhibiting symptoms, they have the ability to test them there on site, and then coordinate for transport to an isolation or quarantine site. There have been, as of yesterday, there were 7,500 connections with folks, but that number has been updated today to 8,500. So a lot of contact. This is also a mechanism for us to figure out where we might want to send one of those mobile testing stations. Next slide. So I think we're all anxious to return to normalcy, you know, so we can see our friends and family and get back to work, and for many people, you know, return to a steady income. But when it comes to people who are unsheltered, experiencing homelessness, I think our hopes are different. We don't want to return to a pre-COVID situation. Next slide, please. So our vision here is really to continue to protect the unhoused, to expand who we're protecting, to work again collaboratively, continue this really unprecedented coordination that's happened among government agencies, and to build resiliency. You know, we're all anticipating, given what professionals are saying, that there will be a resurgence of this virus, and we don't want to be in a place where we have to re-stand up all this emergency infrastructure that we've had to build. Instead, we want to make sure that you know, people who are particularly vulnerable to the virus are already in a place where they can safely you know, shelter in place. Next slide, please. So our strategy is, you know, first and foremost, we're focused on trying to make sure that everyone that we have provided emergency shelter to during this crisis, that they can exit to a housing situation, whether that be some kind of interim resource or a permanent resource, whether it be through moving into a new apartment or perhaps some kind of rental subsidy. But we shouldn't limit our goal to serving just those who have been able to safely move inside. Our goal is to serve that 15,000 target number, those folks who are particularly vulnerable to the virus, that we, in order to be ready for when the virus resurges, we need to make sure that all 15,000 of those folks are in some kind of interim or permanent housing so that they can be safe. And as the supervisor mentioned, also we have a strong focus on making sure that the numbers of folks who are experiencing homelessness does not increase. You know, before the virus in the city of Los Angeles, already 500,000 people paying unaffordable rents. And certainly given the new economic circumstances of many folks, there is great risk for further for displacement and moving into homelessness. So we, in the city of Los Angeles, great focus by the council and with support from the mayor on rental assistance programs, on eviction defense programs, making sure that folks can stay in their homes. The other strategies that we are looking at to meet these goals that I've laid out are using a substantial amount of the CARES Act funding that is being allocated to the city to secure these resources, whether we're potentially looking at some acquisitions, maybe we're dedicating some resources towards the operation of either interim or again in permanent housing. So trying to most effectively put to use the financial resources that are being made available to the city through the CARES Act. Last slide, please. But that's not enough. Really, we're looking at a monumental task. So the city has been actively advocating at both the state and the federal level for more resources in collaboration with cities and counties across the state. We are continuing to urge the state budget this year include $2 billion, but that actually that funding source be sustained year to year so that we can effectively address homelessness across the state. And we're also advocating at the federal level for substantial resources, again, to help with the capital side and the operating side of interim housing, of permanent housing, and then programs to prevent homelessness. We're final slide. So we're excited to work with all of our partners to make sure that, again, when this virus returns, that those who are most vulnerable to this virus, who are unsheltered, are not at the same risk that they are right now.
Thank you, Amy. We really appreciate that. That was quite thorough. And now I am honored to have Ann Sewill, Vice President of Health and Housing at the California Community Foundation, will be our next speaker. She's a long-term friend and partner of the LABC. She oversees CCF's health and housing portfolio, working to develop permanent affordable housing to stabilize LA communities and to address persistent issues and root causes affecting the health of the Angelenos. Ann is a crucial voice that LA needs, as she has been instrumental in creating and implementing successful housing policy for the region, including measures H and HHH. Ann, it is a pleasure.
Thank you and good morning. Thank you, Mary. A friend just texted to say she was watching this and wanted to know who the artist was who did the piece. I mean, this hangs in our convening center, which unfortunately we may not be able to use for many months to come, but it's Jose Ramirez, a Boyle Heights artist who is wonderful and also a third grade teacher at LAUSD school. Could I have the slides? Thank you. So good morning. The California Community Foundation is actually Los Angeles's community foundation. We have been serving Los Angeles for 105 years. And in regular times, we focus our discretionary grant making in 4 areas: housing, health, education, and immigration. Our donors, of course, give to those and many others. We give only in Los Angeles County. Our donors give globally. In a normal year, we give about 30 million from our discretionary money, and our donors give about 200 million. On March 12th, we started the COVID-19 LA County Response Fund, and so far we've given almost 15 million out of that, and we've raised about 35 million. And so this is going to be a significant increase. We've experienced a significant increase in need, and so our philanthropic partners, including our donors and other foundations, and our corporate partners like Wells Fargo, have really joined with us to try to address the needs that have, as both Supervisor Solis and Amy talked about, they have highlighted and brought into a sharper focus the inequities and the underlying needs and problems in the areas of health, housing, and family need. We right now, could we see the next slide, Rory? So on March 12th, when we started this fund, we had already been talking to our community partners to find out what was needed. And we identified the first 4 areas right away. The food area, which I'll talk about last, came out a little later. Initially, the food bank had a lot of resources, but this has turned out to be a huge area of need. In housing and homelessness, we focused on providing services to those shelters that Amy was talking about. Supervisor Solis was talking about the project ROOMKEY. We provided help to the nonprofit partners that are running that. And we also provided support to the health partners who are staffing those shelters. So most of them need some form of nursing support or somebody to determine whether people who are living in them have actually contracted COVID, need to go to the hospital, need to be in a congregate or non-congregate kind of setting. So we provided grants to support that work, also grants to supportive housing providers who found themselves with newly housed people who suddenly had to shelter in place and needed much more support in terms of groceries and sort of on-site social supports. So we've been providing grants for that. In health, we provide every year grants to the 8 community clinics that are specially designated across the county to serve homeless people and who work with hospitals and shelters and street outreach teams. And we helped them with PPE, with patient assessment, with setting up triage areas, and particularly with those connections between hospitals, shelters, street outreach teams. And so we've put out about 3.3 million right now. As you all know, on March 13th, we closed all the schools, and that meant that families and children were not only suddenly, having to figure out how to get meals that had been provided by the schools, and which the schools have been an amazing partner and continue to provide those, not only to their immediate students, but even to the whole community, but figuring out how to get those meals. And then also students needed support to be able to study at home. Significant hundreds of thousands of LAUSD students didn't have the right kind of technology at home to be able to continue to take classes. We have for 20 years provided this small grant program to about 24 partners that allowed them to do hardship grants. We called it the Pass It Along Fund. It was started initially by 2 donors, literally 20 years ago. And if you were St. John's, clinic, for instance, and a client came in and $400 to $1,200 really make a difference, the clinic had access to a pool of funds to make a select number of those grants. And many of our donors, that was what they saw as, that was where their heart told them that they wanted to put their money, was into hardship grants for people who suddenly lost all their income and needed help with food, rent, maybe, medical expenses or car expenses. One of the things we realized really quickly is that, first of all, $1,200, even $2,000 isn't going to pay the rent for more than 1 month for many people, and that this was going to be a multi-month problem. So we are working with our donors right now to raise enough money to help 1,000 families pay the rent for a 6-month period, particularly focused, 1 in 10 adults in LA County is not eligible for the Stimulus Act checks or unemployment due to either immigration status or mixed immigration status in their household. So really have no access to any sort of income support. And so focusing on those families, and that'll be a part of the hardship program. And finally, as I said, food. We have been accepting on our website through a SurveyMonkey, very quick application form, proposals, and have received, I think, 92 proposals from nonprofit groups in our 4 areas. But when we read through them, the underlying issue was almost always, we need to provide food to our clients. Whether it's we need to be able to get it from the food bank and do that last mile of delivery service, or we have tenants who have no way of going out and getting food in our supportive housing projects. It really was about food, and the food bank went from being amply supplied to they have had 173% of the demand that they'd had before this time last year now. So we've put our first round of grant making into food. Our donors are stepping up in a tremendous way, and we probably will continue to work on that. In addition to spending the COVID relief fund, we are now looking, as both Supervisor Solis and Amy mentioned, we're all looking to what comes next. Hopefully the safer at home orders will have flattened the curve, and we will, in safe and careful steps, go back to work. But it's going to be a long time before the economy really fully recovers. So we see ourselves doing, three things besides continuing our grant making. First is filling gaps, especially for immigrants who are shut out of other kinds of support, whether it's in health clinics, whether it's in housing and rent support. That is the real unmet need. Most of the time when people come to us with a proposal, all the time, but in this crisis in particular, the question that our program officers and colleagues ask of ourselves is this a philanthropy-sized problem, or is this a government-sized problem? And if it's a government-sized problem, is it a city, county, state, federal? And the answer in almost everything that is coming to us is, this is a federal problem. We're not gonna, 4 million unemployed people in the state of California is not a problem that we can deal with philanthropic dollars, besides pilot programs and things that demonstrate what's possible. But we need a whole lot more support from our federal partners. And that's why we're very excited and supported about Congresswoman Waters' proposal on the 100 billion for rent support. So we've been stepping up both our grant support and our partnerships with our advocates in Sacramento and DC, focusing on things like rental subsidy and more community development like funds with the CARES Act. We're also preparing to take advantage of opportunities, both in terms of opportunities to ask, as the city's demonstrated in throwing up these shelters. We talk about standing them up, but really they are throwing them up really quickly. How do we take those flexibilities and apply them to the build out of the remainder of the HHH pipeline? We have 10,000 units in the pipeline, 2,000 that are, kind of coming online quickly, but how do we really accelerate that? And so that's one kind of opportunity. And the other is what we saw in 2008, 2009, 2010 is the real estate market softened dramatically, and it was not our nonprofit partners and those that wanted to preserve affordability that swept in and grabbed, or it wasn't, mission-driven developers like Related. It was, Wall Street-driven firms. And so, my motto is don't fight Blackstone, be like Blackstone, and put together a fund to go out and help our partners take advantage of some of the opportunities that will come online to preserve and expand different kinds of affordable housing. So I'm going to turn it back to you, Mary.
Thank you, Ann. And I think you're raising some really big questions here at the end, in addition to sharing with us all the things you've done as a foundation and what you've done for so many years. And I hope to get back to the issues you're raising here at the end. But next, I would like to introduce Bill Witte, Chairman and CEO of Related California. He helped found the California Related in 1989. And previous to that, we were just discussing this, he was Deputy Mayor for Housing and Neighborhoods under Mayor Art Agnos, as well as Director of Housing and Economic Development under Mayor Feinstein. So he is an authority in housing construction and finance, and we look forward to his presentation today. Bill.
Well, thank you, Mary. It's a pleasure to be here. And Ann's comments were a very good segue to what I'd like to talk about. And we have an interesting perspective in that, unlike most developers, we're very active in both 100% affordable housing development, as well as market rate and mixed income housing development. And we're active throughout the state, Northern California and Southern California, in both domains. First question that comes up to us in terms of COVID-19 is, what has been the impact of this on your existing portfolio, particularly in affordable housing? And on the one hand, as I'll explain in a second, the results are perhaps better than we might have feared. Doesn't mean it's good. So we have data from both April and May, and what we found, first in the affordable portfolio, is that there are rent delinquencies in anywhere from 10 to 15% of the portfolio. Where we've seen movement between April and May, I actually thought it would be higher. Where we've seen movement is in April, there were some people paying partial rent, and the percentage of residents who are now unable to pay any rent has increased, even though the overall percentage in the portfolio of delinquencies hasn't moved that much. Interestingly, the percentage of delinquencies in the market rate portfolio isn't that different. It's a little bit higher in LA than in San Francisco. We attribute that perhaps to different job base, particularly a reliance on the entertainment industry versus just tech, which is more Bay Area. You know, a little hard to say. And our focus then, obviously there's no evictions and we don't move in that direction anyway, is to provide with our nonprofit partners and service providers assistance with food and technical assistance to apply for the funding that is available to help people get through this period. We continue to monitor that very closely. Let me talk a little bit though about challenges and opportunities for particularly affordable housing in this time. On the challenges side, good news is largely because of efforts like in the city and county of LA to generate more housing, particularly for homeless. There's an unprecedented number of affordable housing projects out there looking for financing. The bad news is also unprecedented is for the first time in memory, the competition for state tax credits and tax-exempt bonds is leaving many proposals unfunded. And since the allocations of those are from federal legislation, there's only so much state and local government can do to move that. So the concern is that a number of projects in the pipeline, as Amy and Ann referred to, may either get delayed or simply be unable to proceed. The second challenge within that is that, again, because of the COVID-19 effect on corporate balance sheets, in this case, most of the investors in tax credit projects providing that sorely needed equity are large banks and insurance companies typically, and the appetite for investing in tax credits has shrunk. Now, we view that as a temporary phenomenon, but that means not only is it harder to compete for this financing, but there may be fewer buyers of the credits. And I particularly worry that that could affect larger, more complicated, and in some cases homeless projects, which are a little more challenging for investors to underwrite in any event. So we'll see how that goes. And again, I think and hope that is temporary, but is something worth noting. Finally, to some degree in the city of LA, for example, where market rate developers have been required to pay in lieu fees into an affordable housing pot, there has been a lot of stalling or delaying of market rate projects, so there are fewer in lieu fee dollars available, some of which may have been counted on to help some of the affordable housing projects. We'd like to see a little more coordination between local government housing agencies and the state housing agencies, who are split between the governor and the treasurer. The staff running those are new to California, and I think that's a place where people like those, Amy and Ann, people on those calls can be helpful, because the coordination among the agencies, while all well-meaning, isn't perhaps what it might be. So what opportunities are there? Well, the saying goes, don't waste a crisis. And there have been moves at the state level and somewhat at the local level to expedite processing of housing and certainly affordable housing projects. And I don't have to tell the people listening to this how delaying the approvals of affordable housing projects affects not only access to funding, but cost, because you can't manage cost over a 3-year period. And we would hope that there could be more effort aimed at literally moving these projects faster pace. I think there's been some progress made, but more needs to happen. Construction costs, which have been at record highs and have contributed to these record prices, we expect will drop 5 to 10% over the next year. That will not necessarily help market rate projects as much, because market rate rents may drop, but it will have a big impact in the affordable space. And that's from talking to our various contractors. Finally, general comment. As I think some of you know, there are still efforts, and I'm not taking sides here, although I have my own opinions, to focus on issues like rent control and what I would say are the regulatory side of affordable housing. And there is the sort of the son of Proposition 10 will be on the ballot in November. And quite apart from what one's view of this is, we are little concerned of a diffusion of focus between the regulatory side and the produce more housing side. They're not incompatible, of course, but we'll be watching to make sure that people don't, diffuse their efforts, because now more than ever, the need for more affordable housing delivered more efficiently and effectively is greater than it's ever been. So thank you for the time, and I'll give it back to you, Mary.
Thank you, Bill. I'm coming back to you, but first I'm going to go back to Supervisor Solis. Supervisor, we're getting a series of questions for you about this goal of securing 15,000 hotel rooms. It's an LA city, county and city goal, so Amy, feel free to pipe up too. We're currently having 3,000 rooms secured, which is great. What are the barriers preventing this number from growing, and how can the business community help in this effort?
Good question. It's something that I wake up thinking about every day. I represent outside of LA City about 23 other cities. And we really have been working very hard to try to get them to cooperate, to work with us, and to help us identify motels and hotels. And so far, I have to tell you that I feel a little bit comfortable, but I really would like to see many of the other board districts, their offices, being able to have the same kind of cooperation. I mentioned some of the cities that we're working with. I didn't even mention Fairplex. That was one of our first, the Sheraton Hotel, Marriott owned, that we were able to secure, but that's for treatment of COVID to really help to fend off the surge that would happen in our local hospitals, right? There's Pomona Valley out there. And it took us a while because we had elected officials, including federal representatives, that were really coming up with some very egregious arguments as to why it should not be placed in their backyard. And that tends to be, the one factor that doesn't go away. So whether we're in Monterey Park, Bell Gardens, or whether we're in, the city of Rosemead, we continue to find this resistance of elected officials that may not fully understand what the goal is. And the goal is to try to really bring down that curve. And the curve is the fact that there's too many people out on the street, homeless and very fragile people. For the last 3 years, I've been working on this very intensively. And these folks have very severe chronic illnesses that should have been addressed a long time ago. And we have not done our job in terms of the state, the county, and the federal government to help provide them with adequate shelter and protection. Many do have addiction problems, but I wouldn't say that all of them. The ones that we're trying to put into these placements so that they can get well, I really believe are not the ones that typically have that stereotypical portrait. And I've seen many women, this to me has really been shocking, to see women, widowed women, that are over the age of 65 and 70 that have been on the street for 10 and 15 years and have chronic illnesses and lost their homes, lost their families through no fault of their own. And I really wish that people, our elected officials at the local level, will work with us. Right now, we are working with Judge Carter, as some of you may know, and I'm happy that he's going to help us somehow convene these discussions with our cities. And I'm happy to be able to work with the city of LA. We have funded many projects, and I know PATH has been a big partner with us and many of the other entities, and I'm happy to do it. It takes so long, though, to get these things up and going. And I'm just telling you that right now we have about 30 hotels that we're looking at. They're not at capacity. I would say that they're maybe at 25 to 30%. And the goal is to get people that are unsheltered into those places. And let me just give you, if I could, one example. I used one of our parks out in Bassett, unincorporated, for the last 4 months, maybe 5 months. We put about 100 people in there on cots, men, women. Then COVID hit. Then the ability now through the governor to be able to place people in hotels where we were at 100 cots, now we're down to about 40%. Those people have found places in these hotels and motels. And what we're hearing is people are not disruptive, they're getting well. They get 3 meals, they get wraparound services, and some are feeling stabilized for the first time in their life. So we've got to use every tool in our toolbox. right now.
So Supervisor, then what you're saying is that the business community could help, or community leaders or anyone listening on this call, by encouraging local elected officials to embrace the program. And
Including,
the
yes.
culture. Okay, yeah, because the culture is a big part of it. If you're heroes if you do this, right?
And also think about it, if we could get more big hotels, even downtown where the problem is more severe, the folks on Skid Row, if we could get those 300, 200 hotel rooms available, we could do a lot. And many of them are not occupied, as you know. So this revenue goes back to the city, TOT tax, right?
That's right. And then to tack onto that, a question that's coming straight from the audience right now is, will housing be part of the Economic Resilience Task Force?
Absolutely. Infrastructure. When I talked about infrastructure, that's a big component of it. In fact, I have some projects in the queue now at LAC USC. We have a lot of our own personal assets that the county owns. We're going to be able to build, I believe, affordable housing. And I think we can do it because it has all, the challenge, the opportunity, and the crisis has made it all that more meaningful for us to work together.
No, that's very helpful. And Amy, we're getting a question, or a series of questions for you about the rec centers and about post-COVID and what's going to happen next.
Yeah, so the folks in the emergency shelters at the rec centers are the same folks that are participating in Project ROOMKEY. Those were, vulnerable, unsheltered people, so those over 65 and with underlying health conditions. So they're part of that 15,000 group of people that we're going to try and connect with some form of housing. So, strategies that we're looking at, and again, that we're working super closely with our partners at LASA and the county, are potentially buying, using CARES Act funding to buy real estate where we could create interim housing. Perhaps this is, long-term interim housing. We're also anticipating that about 1,000 units of permanent supportive housing just in the city of Los Angeles. That doesn't even include what will be coming online in the county. There'll be about 1,000 units. We're looking at expanding rapid rehousing or some kind of shallow subsidy program. So it's definitely a challenge. And as Anne pointed out, it's a federal level challenge, right? We need to be, advocating aggressively with both the state and the federal governments to try and secure the resources that will allow us to do it. But I guess I just want to highlight one more time how, right, we had a crisis before the crisis, right? But now we need to think about this in a different way, right? Which is, we need to make sure that now we're living in an era when we can be hit with a pandemic, that we have a place where people particularly vulnerable can shelter safely in place, right? Because that's protecting our hospitals, that's protecting people, that's protecting all of us.
Thank you, Amy. And because I'm conscious of time, and I'm just going to use the moderator rule here, I still want to ask Bill and Anne a quick question here that's coming from the audience. Bill, can you expand on the impact of how you see rent control and inclusionary housing? How is that going to impact our ability to produce housing supply?
Well, first of all, they're not the same thing, right. Rent control and inclusionary. Just speaking for Related and not for everyone else, there's rent stabilization as exists in LA and San Francisco, and there's vacancy control. For those who believe that the supply of even market rate housing is important, if vacancy control were to be adopted, we believe it would stop financing of new market rate and even mixed income housing. Inclusionary, I think, is different. Inclusionary, if the policy is understood in the development and real estate community and it's reasonable, we're the largest mixed income developer in California. So we obviously feel we can work with it. I think, though, that not all locations are created equal. It works best in areas that have the strongest markets. It doesn't necessarily work where you're struggling to get any kind of market rate housing at all. And it certainly is appropriate in large master plan communities where property owners or landowners are getting entitlements that they didn't previously have. So I think it's perfectly reasonable, and people just have to be smart about it.
Okay, thank you. And then Anne, last but not least here, should emergency housing resources be focused on preservation or production? Where is Anne Sewell? Anne.
I'm sorry, Mary. Say that again.
Emergency housing resources. We're being asked whether the focus should be on preservation or production, or preservation, acquisition, or production. What is your feeling at this point?
I think it's a both and. You know, we can, people right now are buying land to become affordable housing or supportive housing or something later on. And you know, I don't know if it was the governor gave us or somebody, but there are, you know, hundreds of trailers, as Amy was talking about, all over in rec center parking lots. We could do trailers on those sites that, you know, we could buy, you know, nursing homes that have been depurposed and use them temporarily and eventually redevelop them to higher density affordable housing. I think, you know, we have to think about what we want to preserve and expand from a portfolio-wide basis and from a long and, you know, short, medium, long-term basis. As Amy keeps saying, and it's totally true, we had this problem before the pandemic. The pandemic is only making it worse. We need to take the short, immediate, you know, and long-term view to get out of this as well.
That's right. Okay. And with that, I'm going to wrap this up. I wish we had another hour just to talk about it, because I feel like you all have communicated so much good data for people to think about it. And it would have been really fun to have a robust conversation about it, but maybe that's going to have to be webinar number 8. So I want to thank you today for your time and your expertise and your hard work and your leadership in this area. And I want to give Adam Lane 1 minute to wrap up about this important legislation that's pending, particularly some of the federal bills that we have particular interest in that really need Democratic and Republican support. Bipartisan support will be key. Adam.
Yeah, thanks, Mary. So as Ann mentioned earlier, and as Mary mentioned, we were excited to see that Congresswoman Maxine Waters, who we featured 2 weeks ago now on a webinar, has introduced a piece of legislation that would be $100 billion in emergency rental assistance to help keep families stably housed and to prevent homelessness. So of that $100 billion, as of now, 40% of the funds would be allocated for households making less than 30% AMI, not less than 70% would go to serve people below 50% AMI, and the remaining funds would be for people up to 80% AMI. Interestingly enough, they put in a provision that would allow the HUD secretary to spend up to 120% AMI if they felt that the 80% AMI spending requirement was fulfilled. So we could potentially have some middle income dollars there. It would specifically support short and medium term rental assistance for up to 24 months or up to 6 months of back rent and late fees. And the grant funds would go directly to the housing provider on behalf of the tenant. So that bill already has 100 original co-sponsors in the House. As of now, it is a Democratic bill only. I think it's going to move into the Senate, but now I think all the work is going to be to get senators to weigh in with Senator McConnell to see if they can get some Republicans on board. That'll be the big fight. So that's it on the federal level. On the state level, the legislature has reconvened after a delay due to COVID. We're supporting a series of legislation. I'm only going to mention a few for time, but namely AB 1907 by Assemblymember Santiago, which we are a proud co-sponsor of. That would exempt from CEQA all shelter, supportive housing, and affordable housing projects until 2029. So any discretionary actions would be exempt. And that's going to the Natural Resources Committee on May 13th. We would love for you all to send in a support letter. And then we have several bills that are headed to the Housing and Community Development Committee on May 20th, which are AB 3107 and 2345. Both have to do with expanding the incentives and the density limit and the density bonus program, and another bill by Assemblymember Santiago, which would allocate $2 billion annually on an ongoing basis to address homelessness and housing that would be provided to cities and counties. We've set up easy tools for you to go online on the LABC website. If you go to labusinesscouncil.org and go to our Action Advocacy Center, We've put simple one-click letters you can send in. You just click on the link, fill out your information, and then you can send a letter to the committee chairs. And then locally, we're continuing to support the county's push to house the senior homeless population. A few weeks back, we sent in a support letter for Supervisor Ridley Thomas and Han's motion to craft a comprehensive strategy to house all the homeless individuals that are currently in emergency COVID housing. And that's the first report back, and the second report back would be a comprehensive strategy to house the whole senior population. This is a major first step because this is a growing demographic of the homeless population. And as our demographic and age gets older and older, it's going to be a larger percentage of our homeless population. So if this pilot can be successful, it shows that by targeting a comprehensive strategy at a certain homeless demographic, we could potentially expand this to the whole population eventually. So that's all the updates for me as of now, as quickly as I could.
It's very good, Adam. That was
So much
excellent.
going on in public policy, but thanks, Mary.
You did a great job. And I would really encourage people that feel strongly about these issues to get behind this legislation at both the state and federal level, because as all our panelists have talked about, this is a big federal state issue. We can't solve it by ourselves. That means people have to take positions and let elected officials know that you care. Also, I want to thank Greg from Wells Fargo one more time, because I think Wells Fargo really has stepped up during COVID and before, particularly on this issue, and we really value their partnership. I also want to say that for next week, please join us, because we will have Superintendent Austin Buettner with us on Tuesday, and we'll have Mary Nichols and David Hotchkiss and Sammy Roth with us on Thursday. So in addition to housing, we're also discussing sustainability and your favorite subject, Supervisor, economic development. So stay tuned, because there are many more webinars to come. So thank you all for participating today with us, and we look forward to working with you. Continue to work. Okay. All right, you guys.